Limpopo has established vaccination task teams and various committees that will oversee the rollout of the first phase of the inoculation process. For more on the province's rollout plan, I'm joined now by Limpopo's Health MEC Dr. Phophi Ramathuba. Very good afternoon to you. Very good to be chatting with you this afternoon. We saw you as well as the Limpopo Premier outlining the plans that you have for the vaccination rollout. If you could outline those for us, the 3 different phases that you mentioned, as well as when these plans will actually start.
Afternoon to all your viewers out there, and thank you for inviting us. We can confirm that indeed today we have just completed our launching program of the phase 1 rollout. If you would remember that after we had that hiccup of AstraZeneca, government acted swiftly, and we therefore received a confirmatory letter on Monday that we will be receiving a total of 3,358 vials, which you can translate them to 7,162 dosages. And indeed, they have arrived at the research site, which is in Lovuke, somewhere around Moti. That is a research site, but the vaccination sites, according to national, were chosen as Pietersburg Hospital and Mankweng. The Premier earlier this afternoon had officially launched this vaccine. I have already received the vaccine, mainly as a health worker, and also to be able to reassure the public that indeed the vaccine that we are providing to our healthcare workers, it's a critical one. There's nothing wrong with it. It is important that we do especially provide it to our last line of defense, who are our first liners, because when we get into the 3rd wave, we want to be prepared so that we don't experience what we experienced during the 2nd wave, where some of our nurses, our doctors were sick, and our patients had no one to look after. So what's going to happen from now? There is a slight adjustment compared to the initial plan that we had when we had to plan on an amount of 44,520 dosages of AstraZeneca. Now we had adjusted our strategies, and we have already started now, as I've indicated. Our healthcare workers are being vaccinated as we speak. We will be working throughout tomorrow. We already have got 20 vaccinators in this particular site of Mankweng, where it's a collaboration, wherein we have got our researchers from the Lovuke group, led by our principal investigator, Dr. Mabua, and she's got also a team of IT that is supportive, and we've got also our own vaccinators who will be there. So our strategy still remain. If one vaccinator is to vaccinate 50 people, we know if we are going to be working over the weekend and work on Monday, once we start as Limpopo, there's no turning point, because what we took in the past 2 days when other provinces were launching and we were still waiting was, as our Premier will always put it, plan and make sure that your plans are perfect or almost to perfect, so that when you start, there is no glitches. And I can reassure you, once we start like we've started now, you are going to see us targeting all the targets that we have been provided. And come a Monday, because over the weekend, we are also targeting our GPs, so that those who, when they are not busy, especially on Sunday, we've already been informed there is 99 of those who have registered. We hope by Monday, 99 general practitioners would have been vaccinated in the province. We are also with the manager of CEO, manager of Netcare, Mr. Fabian here. Mr. Fabian from Netcare Puluso has also committed some of his staff members who, over the weekend, we will be dedicating them to vaccinate them. And again, we'll continue on Monday in these 2 sites. We know by the end of the week, we would have completed the target and wait for the 2nd batch.
And what is your target? You have confirmed that you received in total 3,358 vials. What is your target number of healthcare workers to inoculate this time round?
Our target is dependent on the vaccines that we've been provided. Like what I've indicated, the vials that we've received are translated into 7,162 healthcare workers. And we are reassuring you that we would have completed the 7,162 before we receive the second batch. So we are not in control of the target. The target is controlled by the number of vaccine that we receive from national.
And what is your sentiment, MEC? The fact that this time round you can only inoculate just over 7,000 healthcare workers, but the target of healthcare workers that you need to inoculate in your province stands around 50,000.
Of course, as I've indicated in the beginning of this interview, when I said there has been a setback, of course, we had planned for AstraZeneca where we were going to be vaccinating 50,000 healthcare workers. And unfortunately, due to all those, and we must be appreciating to say it's government that also initiated, and also through its own processes, through its own researchers, we found that there are shortcomings on that particular vaccine, but acted swiftly. The bottom line is that we have not stopped and say we are waiting for the total number of those 50,000 to arrive, whether it's Pfizer, because we are also waiting for Pfizer and all other vaccines. We did not sit down and fold our arms and wait. It is a setback because it readjusted our plans. However, we have started to vaccinate. And if we vaccinate 7,000 employees over a period of 5 days, we have vaccinated, they have access. What is important is that while it's another research or another phase or phase 3B of a clinical trial, what is critical is that it has managed to fast track the accessibility of this particular vaccine on the healthcare workers, because ordinarily we're going to wait for all those 50,000 to arrive, which also is another time that can be wasted.
Let me ask
as I've indicated earlier on.
Let me ask you this, MEC. Yes. What is it that by the time you're done with the process, the 7,000 who would have been inoculated, what is it that they will be able to do that those who have not yet received the vaccine will be able to do? Is there going to be a difference there in perhaps their responsibilities, because now they are assumed to be, safer?
Perhaps we need to appreciate what is the role of this vaccine, and listen to what mainly our professors are always indicating. People should appreciate the fact that the role of these vaccines, mainly, for instance, Johnson & Johnson, it prevents hospitalization by 100%. It prevents mortality by 100%. I want to correct that. And it prevents hospitalization by 85%. It also, at the same time, prevents its efficacy on this a new variant that we have by 57%. So it doesn't matter whether you were vaccinated by which or what type of virus. At the end of the day, this vaccine, it's not necessarily going to stop you probably from getting infected, but it will be able to boost your immune system so that you can fight this virus when it enters your body. So when we vaccinate this 7,000, the advantage of them, that's why we are starting with those who are working exactly in the COVID-19 ward. We are starting with healthcare workers because we are saying, should there be the virus, this 7,000, if they were going to be sick or if they were going to be hospitalized, they would not necessarily have to be hospitalized or to even losing them. We have lost over 663 healthcare workers in this country. In my province, we've already lost 38. Now, if we had this vaccine prior this whole virus, 38 employees who are health workers in my province would have survived. Over 1,000 that were admitted in different hospitals would not have required hospitalization. So it is important, and just to vaccinate one healthcare worker, it's very much important and critical because you would have preserved that particular life of that particular healthcare worker.
MEC, we thank you. MEC, unfortunately, time is not on our side this afternoon, but thank you very much for the insight and the detail that you've given on the Limpopo Provincial Rollout Program. Thank you so much. That's the MEC for Health in Limpopo, Dr. Phophi Ramathuba.